Good morning. Thank you for attending today's community awareness presentation. Today I'm going to be talking to you about our Dementia Capable Care Specialist Training Program. My name is Sloane Pharr, and I'm a board-certified behavior analyst and an international behavior analyst. In addition, I'm a Dementia Capable Care Specialist and certified instructor. These credentials enable me to fuse the science of behavioral gerontology with the Crisis Prevention Institute's Dementia Capable Care program. In today's community awareness presentation, we will cover the following. What is CPI and dementia capable care? What is dementia? What challenges does dementia present to the individual? What challenges does dementia present to the caregivers? What is the Dementia Capable Care Specialist Credential Training? Why should care partners be trained as Dementia Capable Care Specialists? And program objectives for the Dementia Capable Care Specialist Credential Training. The Crisis Prevention Institute is the worldwide leader in evidence-based de-escalation and crisis prevention training and dementia capable care specialist services. So what is dementia capable care? Individuals with dementia don't need to suffer from dementia. Informed care can be provided to improve and support these individuals. The Dementia Capable Care approach is a commitment to changing the focus of care to what a person can do. It supports the use of skilled approaches to pull out capabilities and support challenges. It also helps those in care to remain successfully engaged in meaningful life activities at their best ability. All individuals, including those living with dementia, can live in emotional well-being and don't have to live with distressed behaviors. Alzheimer's disease and other dementias cause changes in the person's cognition, physical and motor abilities, perception, communication, feelings, as well as personality. It has been acknowledged by the Ministry of Health and Wellness that prevalence rates of dementia cases is likely an underestimation in the Cayman Islands. It is expected that there will be a 155% increase in the prevalence rates over the next 3 decades. The 3 most common forms of dementia are depicted in this graph that shows the differences among the 3 with regards to changes in cognitive status across time. These include Alzheimer's disease, vascular dementia, and dementia with Lewy bodies. Alzheimer's disease is the most common form of dementia. It is an irreversible progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest of tasks. As the disease progresses, you will notice a change in the person's instrumental activities of daily living, which are activities related to independent living, such as doing laundry, meal preparation, managing finances, house cleaning, and managing medications. As the disease progresses further, you will notice changes in the person's ability to perform basic activities of daily living, which are activities related to personal care, such as eating, bathing, getting dressed, and self-grooming. Vascular dementia is a general term describing problems with reasoning, planning, judgment, memory, and other thought processes. This form of dementia can result from a stroke. The onset is usually more abrupt than that of Alzheimer's, and the decline is usually noticeable and sudden. It happens in downward steps, which means the person's cognitive abilities will remain the same for a while, and then significantly decline as they experience another vascular event such as a stroke. Vascular dementia is more common in males than females. Dementia with Lewy bodies, also known as Lewy body dementia, has a fluctuating course, as is seen in the image here. That means that the person's cognitive and functional abilities vary from hour to hour or day to day. This can be challenging for care partners, as the person's level of independence and cognition can significantly change. Care plans need to be flexible and adapt to meet the person's changing needs.
Another sign of Lewy body dementia is that the persons may have episodes of hallucinations and signs similar to that of Parkinson's. Frontotemporal dementia is a broad term used to describe a group of uncommon brain disorders that are chronic, progressive, and irreversible with a straight downward trend. The areas of the brain primarily affected by this diagnosis are the parts of the brain generally associated with personality, behavior, and language. This can often lead to unpredictable distress behaviors, such as a person might start laughing and crying for no apparent reason. A person's ability to communicate changes early in their diagnosis, and they may lose the ability to retain words. It is usually a change in the person's behavior and communication that comes before symptoms such as memory loss. It isn't unusual for frontotemporal dementia to present in a younger population. Typically, the person may be diagnosed in their 40s or 50s. The common changes associated with Alzheimer's and other dementias can impact the individual and those that care for them in many ways. Overall, the common changes impact the person's ability to function independently. They also impact safety, health, and the quality of life. All of this can make a person feel distressed and may lead to behaviors that could put their health and safety at risk. For the carer, the ultimate goal is to provide support that promotes the best ability to function and quality of life. Supporting an individual means recognizing and knowing when to adjust your approach and to compensate for the person's cognitive and functional deficits or challenges. However, this is far from easy, especially as the stages of dementia progress. Some examples of challenges a care partner may encounter and need to support may include the need to support mood changes and the individual's ability to control their own emotional responses, difficulty helping to support the person's degree of independence, comfort, and quality of life due to sensory limitations such as smell, hearing, vision, touch, taste, or ability to register the level of pain, the need to provide extra support to ensure safety from falls and with activities of daily living, or those related to personal care. A person's cognitive level is what primarily determines how capable they are of doing what they want to do and need. If they have a limitation in any component of function, they will need additional individualized support. Dementia Capable Care Specialist Credential Training provides care partners with a common framework about Alzheimer's disease and other dementias, a best abilities perspective, dementia stages, behavior management, and care techniques to promote the best ability to function. This program combines the Allen Cognitive Levels, person-centered care, and the CPI Crisis Development Model to empower caregivers and care partners to prevent and de-escalate distress behaviors. Dementia-capable care is most appropriate for professional care partners. However, in many situations, it is the family member that is the care partner. In these cases, dementia-capable care is very beneficial as well. If you work with people who have Alzheimer's disease or other dementias and are responsible for their care, this training will give you a framework you can continuously return to address different situations and build expertise in dementia-capable care. It will help you to better understand the person in front of you and how they are impacted by dementia, and how you can ensure that what they can do and may do, they will do. This training will provide a common foundation to better understand Alzheimer's disease and other dementias, a best abilities perspective, and care techniques to promote best abilities at every stage of dementia. It will enhance skills in providing person-centered support for individuals with dementia. It blends two powerful CPI training programs, Dementia Capable Care and Nonviolent Crisis Intervention Training, in order to allow for the interdisciplinary teams serving these individuals with dementia to work together efficiently and effectively. The course philosophy embodies an abilities-based approach to care, rather than a focus only on the limitations dementia may create for the person. You will learn strategies for matching care approaches to cognitive levels or dementia stages
and facilitating a person's best ability to function. You can apply these strategies right away in your workplace, and the training will help you to recognize, respond, and calm the individual using non-pharmacological and non-restrictive approaches. During the training, participants will explore the principles of person-centered care, learn the basics of Alzheimer's disease and other dementias, explore care approaches that promote the best ability to function, learn to use observation, reporting, and specific assessment approaches, explore early and middle stage cognitive levels, explore late and end stage cognitive levels, learn to better understand distress behaviors communication, apply their knowledge to better support the journey of loved ones, be introduced to behavior intervention, explore precipitating factors and effective communication, identify behavior using the CPI crisis development model, and learn to apply their knowledge when responding to crisis behavior. Finally, the training will explore and practice debriefing. The delivery format overall includes an orientation, that's about 1 hour, online self-paced coursework for a total of 3.5 hours, an instructor-led classroom training portion, which is on average 3.5 hours. And in terms of post-training, we have action plan development, a classroom test, and a training evaluation. That would be about 1 hour. So in total, to attain the Dementia Capable Care Specialist credential, you would have to participate in training for 9 hours. Our Dementia Capable Care services include Dementia Capable Care training, direct behavioral gerontology services, family consultation and support, as well as multidisciplinary collaboration. Some insurances may cover some of these services. You can contact me to get started by scanning the QR code provided, or contact me via email at spharr, spharr@wellnesscenter.ky. Thank you so much for listening to our Dementia Capable Care Specialist Credential Training Community Awareness presentation. I hope to see you soon.